Make sure to follow the directions on the product package. Check the label to see if the dose should be swallowed whole, chewed, sprinkled onto food, or mixed with liquid. If you're using the liquid form, be sure to measure the dose carefully with a special measuring device/spoon, as household spoons may not provide the correct dose. If you have any questions, consult your doctor or pharmacist. Some probiotic products contain live bacteria, such as bifidobacteria. If you're taking antibiotics, it's best to take any product containing live bacteria at least 2 to 3 hours before or after taking antibiotics. Be sure to follow the directions for your specific product. If you're using this product for diarrhea due to antibiotics, do not use it if you have a high fever or for more than 2 days, unless directed by your doctor. If your condition lasts or gets worse, or if you think you may have a serious medical problem, seek medical help immediately. If you experience an increase in stomach gas or bloating, it's important to let your doctor or pharmacist know. Additionally, if you notice any signs of infection, such as a persistent cough, high fever, or chills, it's important to seek medical attention promptly. While a serious allergic reaction to this product is rare, it's important to seek medical help right away if you experience symptoms such as a rash, swelling of the face, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you experience any other effects, it's important to contact your doctor or pharmacist. It's important to note that if you're in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking this 30 billion cell capsule, it's important to let your doctor or pharmacist know if you have any allergies. This product may contain inactive ingredients that could cause allergic reactions. If you have certain health conditions such as prolonged diarrhea, a weakened immune system, recurring vaginal or urinary tract infections, diabetes, or phenylketonuria, PKU, it's best to consult your doctor or pharmacist before using this product. If you are pregnant or breastfeeding, it's important to discuss the risks and benefits with your doctor before using this product. And if you are planning to have surgery, make sure to inform your doctor or dentist about all the products you are using. It's important to be aware that probiotics like B.subtilis B.coagulans bifidolactobacillus 30 billion cell capsule may interact with certain medications, potentially affecting how your medications work or increasing your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist, including prescription/non-prescription drugs and herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some medications that may interact with certain probiotics include antibiotics, antifungals such as clotrimazole, ketoconazole, griseofulvin, and nistidine. Be sure to consult with your healthcare professional before adding this supplement to your routine if you are taking any of these medications. As always, it's crucial to follow your doctor's advice when it comes to managing your medications. If someone has taken too much of this medication and is experiencing severe symptoms like losing consciousness or difficulty breathing, it is important to seek immediate medical attention. You can call 911 if the symptoms are serious. Otherwise, you can contact a poison control center for help. In the US, you can reach out to your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center for assistance. Be sure to attend all of your medical and lab appointments. Certain brands of this medication may also include additional ingredients, like fiber or inulin. If you have any questions about the ingredients in your specific brand, be sure to consult with your doctor or pharmacist. If you happen to forget to take a dose of the B.subtilis B.coagulans bifidolactobacillus 30 billion cell capsule, you can take it as soon as you remember. However, if it is close to the time of your next scheduled dose, it's best to just skip the missed dose and continue with your regular dosing schedule. It's important not to take a double dose to make up for the missed one. Remember to always take the capsule at the same time each day for the best results. When it comes to storing probiotics, it's important to follow the instructions on the product package. Some may need to be refrigerated, while others should not. If you're unsure about how to store your probiotics, ask your pharmacist for guidance. It's crucial to keep all medications, including probiotics, out of reach of children and pets. When it comes to getting rid of expired or unneeded probiotics, don't flush them down the toilet or pour them into a drain. Instead, consult your pharmacist or local waste disposal company for the proper way to discard them. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.